Put our hands together and welcome Dr. Martin Roberts. Dato Tik bin Mustafa, Chairman of the Trumer Group of Companies, management and staff of the Trumer Group of Companies. Ladies and gentlemen, good afternoon. A little brief introduction of myself. I'm actually now working in UMMC, University Malaya Medical Center, Faculty of Medicine. I'm actually a clinical microbiologist by training and profession. I am also a lecturer in UMMC, and I also work in the CDC, which is also known as the Center of Disease Control in University Medical Center. And I'm now presently on an attachment with a private hospital in Suraman. It is called Negeri Sembilan Medical Center. I work there now, and my contract with the hospital ends at the end of this year, December, and I'll be back resuming my lectures in January 2012 at UMMC. Alright? Today I'm going to be talking to you about a very unique breakthrough in medical science, something that took me more than 10 years to research. This is a passion which I developed over the last 15 years. Before the year 2000, I was looking at, what can I do to mankind, to help mankind in offering an alternative treatment for various infections caused by bacteria and viruses. Now, most of you would know, if you are infected, whether you have a cough, cold, common flu, maybe food poisoning, you will always resort to some antihistamines or antibiotics. And as you are all aware, antibiotics and antihistamines are also known as allopathic drugs, manufactured by companies like GlaxoSmithKline and even Pfizer. So it falls under the Western medicine known as allopathy. And while the last 10 years, I decided to do extensive research on a joint collaboration with Johns Hopkins in the US, and with a fellow colleague of mine, Professor Dr. John Stewart, who's based in Canada, and also a very renowned molecular biologist and microbiologist at Brigham Young University in the US. So I traveled to Canada, and I got to meet up with everybody. We decided to do out some trials using ionized electrode silver particles. Today's presentation will be on a subject which I think most of you would not have heard, probably would have of late. It's called the breakthrough in nanocolloidal silver in a suspended form. Most of you here will be thinking, wow, silver. Now what is the use of silver? What can silver actually do as an alternative medicine and as an alternative therapy? Now we all know that silver has got a lot of uses, more so in this common, this present era. Jewelry is usually made of either gold, and of course now silver is also expensive. And it has got a very rich history of curing all types of ailments and diseases, including major infections caused by bacteria and various types of viruses. Now, if you go back into ancient Greece, even ancient Rome, a lot of the silver containers used by the people at that time are to store water and milk. Why? What do they discover that is so unique about silver containers? How can it possibly preserve water and milk and other types of liquids without bacterial contamination? If you look even in the Middle Ages, silver is also used in battles. For example, they have tumblers of silverware, and they soak their gauze or in dressings into water that's kept in silver containers. The reason is actually very simple. During the last 20 years, we discovered that silver actually has a natural preservative effect. So it's a natural preservative in that sense of the word. And when you look at silver spoons used by wealthy families in the Middle Ages, even in Europe, and the saying, born with a silver spoon in your mouth. Actually, the story came about a very wealthy family during the Middle Ages. One of the children, the daughter, had a very severe toothache, and at that time there were no dentists available, so they had to resort to extraction. If you have a tooth decay, the usual process is just to extract the tooth and then leave it as it is. Now, because of the excruciating pain suffered by the little girl, the father said, "Why don't you take the spoon and grind your teeth?" Because that was a silver spoon. So she took the spoon and ground the teeth for a while, and the pain went off. So the saying goes to that particular age. People with silver spoon as cutlery in your house actually can use it as a remedy, to treat pain, caused by bacteria in this case. Now, very interestingly, when I was in Canada, we had to perfect, the use of silver. Now, you're talking about silver as a metal, right? Now, you heard the story about the silver spoon. Now, how do we actually make use of the silver, at that point in time, to convert it into a preservative, a natural antibiotic in that sense, or a natural antiseptic? Now, this is extremely difficult. So we had to adopt nanotechnology. I have written a book, on this particular subject. You can probably get it from Trumer. And in this book, I talk about nanotechnology. Nanotechnology, is all about manipulation of matter. It's actually bringing a big object to make it into the most minute particle. In this case, we are talking about nanometers. If you understand a bit of maths, arithmetic, and chemistry in this case, we're talking about design and engineering of structures, manipulating them into a size that is below 100 nanometers. Today's technology not only encompasses about the finding of a product, or finding of a solution, converting, making use of water to adopt nanotechnology, but it's also used in space, it's used in the engineering world. We're talking about minuscule objects that can create a whole lot of dimension, that can do good, whether it's in engineering or whether it's in healthcare. Now, 1 nanometer is 100 times smaller than the diameter of a human hair, which is the 1 billionth of a meter, if you know a little bit of the metric system. I have here a very simple graph that shows the particle size. That's my off. Where do you find dust mites? Carpets, and more often than not in your bedding, the beds that you sleep on, right? That's where they are. Now, if you know the latest technology, you probably would know that a lot of the bedding companies like Dunlop, Dreamland, they're all now using nanotechnology, and they're even incorporating silver particles in the bedding, for example, the mattress, to actually kill bacteria, right? And also to drive away dust mites. It is now in the market, for your information. And then we have here, this is a human hair, which is about 60 to 120 microns. This is 200 microns. These are all in microns. And if you look at the DNA here, it's between 2 to 12 nanometers in diameter size. Now, we had to do a lot of work because we need to identify what is the size of a particular bacteria or a particular virus. There are many types of pathogenic bacteria. When I say pathogenic, means they are harmful bacteria. Like Dr. Tan was talking about probiotics. So we talk about friendly bacteria, and now we're talking about the size of the bacteria. We're talking about the deadly bacteria, which is in the form of a pathogen. And we had to come up with a silver. How do you bring a silver metal to below 10 nanometers. Impossible. No way. You have to use science, you have to use physics, you have to use engineering to bring one particle size, for example, 1 micron, or even the size of a silver bar, for example, which is maybe about 6 to 7 mm, the thinnest plate. Now, to bring it down to below 10 nanometers is virtually impossible. So we had to use design and engineering, technology to make it into nano size. So what we did was very simple. We got together, all of us got together, and we came out with an electrolysis generator. It is called a silver electrolysis generator. This generator, when it's charged with alternating current, AC, DC current, it creates what we call ionic dispersion from the silver. The silver becomes ionic. It actually cannot be seen. It's just like this bottle of water here. I can show you in the glass. It's just like normal water, and you can't even see anything inside. It's just like drinking water. So you can imagine, the size, the particle size, which is, beyond comprehension. I will show you a photograph, the kind of equipment that requires one to actually look under a microscope. Normal microscope won't be able to even see the particle or the ionic silver that's found in the solution. So nanocolloidal silver, as I mentioned to you earlier, it's in a suspended form, it's in a colloidal state. I'll show you another slide which actually shows the particle size. Now you look at all these little dots here, they're actually ionic silver particles, but they are all below 10 nanometers. This one uses a very special microscope, and that will only be able to detect the silver particles in a suspended form. And it's also sub-microscopic, but in the size of a nanometer. It's a non-chemical process, as you can see that we only use distilled water. As I was explaining to you earlier, the fact-finding mission, the medical and the scientific breakthrough, the research, we all needed to find something that can actually effectively kill bacteria, fungi, mold, yeast, and viruses. These are found in our homes. They are found everywhere around us. In fact, where you are seated, you can find probably some fungus and some mold in your chairs, right? So you don't run away from this pathogenic bacteria or microorganisms. They're always around us. And to kill this kind of bacteria or viruses, you need a very strong dose of antibiotics. All right. Now you all know for a fact that you go and see your GP or you visit your regular physician. They will always give you a class of antibiotics. I'll come to the antibiotics a little later when I move along. Now this is do you know what is this? This is a typical agar plate. This is an agar plate. Now what do you use agar plate for? If you are a science student, you will know what an agar plate is. You normally use this to do culture. Any kind of culture, bacteria mostly, mold, fungus. This is a culture, which I took in a very, very well-known hospital in this country. And this is before the treatment of the colloidal silver. And this is of course the after. Now here you'll find that the black are the mold, and then all these here are bacteria. They are a combination of mold and bacteria. And of course, identification of the bacteria is actually very crucial. You find that a lot of hospitals do not have the facility to identify the type of infection that you have. They will just say you have a viral infection. But what is a viral infection? Maybe you can identify H1N1 or H5N1 or maybe an influenza A virus. But in the case of bacteria, there are 600 over types of pathogenic microorganisms. And how do you know which one is the cause of that particular infection? And unfortunately, our country do not have the capability to detect or even identify pathogenic microorganisms. We have to send them abroad. And you find a lot of patients in hospitals, they suffer from paralysis, even patients as young as 20 years old, And I can tell you this is quite shocking, because when I was 2 months ago, I think you probably would have read in the papers, there was a young student, 19-year-old student. She was infected by the adenovirus. Okay, the adenovirus, everybody can identify what it is. It comes from a viral family, 5 mutated strains, and it causes paralysis. Now, then you probably would have heard of different types of bacteria that has been recently discovered. The hospital that was treating the patient couldn't identify what caused her paralysis. She was actually in semi-coma. All they could identify was the adenovirus, but they couldn't find anything else. Today, she still is in a semi-coma state in this big hospital. Can't even identify whether it's a bacteria or virus that has actually caused her to be in that coma state. That's the sad part about the technology that we have in this country. And normally what we do is that we do a count. Now you need to understand at what rate, we are talking about parts per million, at what rate can a doctor or a specialist determine you to be infected or by a bacteria or a virus. Now there's always a count. It's very, very important. You need to do the count. So here I did a very simple swab test. A swab test means I just take a piece of cotton with a bit of saline. I just rub maybe 1 square inch of the wall or any other surfaces that you think. In fact, you probably will be surprised there may be some bacteria around here. Alright? So we take the swab, we put it in saline, and then we incubate it for about 48 hours. Then we culture it. Then we can count what type, how many types of bacteria are there, or maybe it's 1 strain. So the count that we use is called CFU, colony form unit, if you understand a bit of science there. And we use colloidal silver. We dipped a little bit of colloidal silver, which is below 5 ppm, below 10 nanometers in particle size. And within 20 minutes, all gone. I mean, this is just what we call a lab test, right? I mean, you need to do a test on infected blood, right? So, and that's when I've done all the clinical trials. I don't think I will have the time to go through all the clinical trials, because it's going to take me probably 2 hours to complete, but I'll just run through all these slides so you have a basic understanding of what it's all about. Now, you see that E. coli. What is the other bacteria that is commonly found in water? Now, for example, if you have diarrhea, that is caused by food poisoning, and that's also obviously caused by bacterial poisoning. 2 possible culprits are the cause of your diarrhea or food poisoning. That's E. coli. And the other one is salmonella, which is very commonly found in contaminated water, even contaminated food, for example. So the culprit is E. coli and salmonella. Continue now here. This is the favorite part that I want to emphasize a little bit. You probably would have heard of MRSA. Anybody here has heard of MRSA? Methicillin-resistant Staphylococcus aureus. Okay, it's a bit of a mouthful. Staphylococcus aureus, that's how you pronounce it. I will come to a little bit on Streptococcus because there was a recent article on Streptococcus a couple of days ago. Now, this is the most virulent, most pathogenic it's the mother of all bacteria, right? And this bacteria, sadly, it's commonly found in hospitals. Fortunately, not in homes, right? Now, let's go through it one by one. Very common in hospital. It's an acquired infection worldwide. Practically every hospital has got this bacteria, thriving and living very comfortably. And if you have open wounds, for example, surgical sites means you are on the operating theatre. That means you had surgery. That's the meaning of surgical sites. And then you have any breaks in the skin. For example, I was just talking to a couple of colleagues of mine, and I was saying that if you happen to walk into an ICU and you start to scratch and you cause an abrasion to your skin or breaks in the skin, you're very likely 90% to be infected by this bacteria, Staphylococcus aureus. And its mortality rate is very, very high, 70 to 80%. Death, ICU, very common. And what it does, it causes severe boils, fatal infections to the bones, heart, which is, we're going to talk to you about this particular bacteria shortly, and then blood poisoning. And it's a drug-resistant bacteria, unfortunately. Now you can think of all the antibiotics in the world, amoxicillin, afoxicillin, and the most expensive of all antibiotics is zithromycin by Pfizer. Okay, amoxicillin is a very common antibiotic that you all will usually get from your doctors. It's a prescription. It's generic. Zithromycin is original drug. So you take zithromycin, probably take you 3 days maximum, to recover. But if you take 4 capsules of zithromycin, on the 4th day, all your friendly bacteria from your colon is all wiped out completely. And then you feel very tired, you feel very lethargic, and then you will have nausea, and the other types of side effects. And so that's why the doctor always tells you cannot take your antibiotic course more than 3 or 4 days, maximum 4 days if it's generic. Asian countries, 70 to 80% hospitals are infected with MRSA. In the year 2003 and the year 2007, I visited 10 hospitals in Malaysia with the permission from the Ministry of Health. I also sit in the advisory council with the Ministry of Health on due diligence. So, I was given the opportunity to visit, several big hospitals in the country, and sadly, all of them had very high rate of bacteria presence in most parts of the hospital. The only place that you're supposed to be completely sterile, which is sterilized area, is your operating theaters, because of the temperature. The aircon is also very important. If the aircon is below 18 degrees, bacteria usually won't survive. Then you have here, now this article just came out about a couple of days ago, I think 2 days ago. Now IJN, the Institute of Jantung Negara, the heart center in KL, 3,000 patients visit IJN for rheumatic fever. Rheumatic fever is an infection, it's a bacterial infection. It causes the heart valves to to rattle, and to also cause murmur in the valves, if you understand a bit of how the heart function. And the cause of this heart valve infection or the fever is this bacteria, Streptococcus. Streptococcus is also another common bacteria found everywhere around us. Now here you have the types, I was mentioning to you the mother of all bacteria, and it causes all this: food poisoning, toxic shock, eye infection, pneumonia, meningitis. And one last point which I have not mentioned here is septicemia. Now septicemia is a very severe infection caused by this particular bacteria, and is fatal, right? Just to let you know, my mother-in-law passed away 3 weeks ago. She had brain surgery. She had a clot in her brain. She had one of her pituitary gland ruptured, and she had an operation. She was in ICU in KLGH, and unfortunately, she suddenly she didn't wake up from a coma. So the doctors decided to do a very extensive blood test. We sent it to Gribbles. As you probably know, Gribbles is one of the better pathology and clinical laboratory in the country. It's an Australian-based company, so they are very, very, very well equipped. And they discovered that the cause of the death was septicemia. I presented this paper to the Ministry of Health in 2006 together with Professor, now he's a professor, Dr. Misni. He's the head of the Department of Chemistry. And at the time, I was representing the Department of Chemistry in Campbell University. So we did this, we decided to go a little bit deeper into understanding, how can we just prove to people that the presence of silver appears in this bottle of water. The only way you can do it is to go through an electron microscope. Now this particular slide, which was done under a electron microscope, clearly can identify the presence of silver. We use that to we put a probe, because this particular probe in this microscope can detect all kinds of metals. We're talking about arsenic, we're talking about mercury, we talk about gold and silver. So this machine will be able to detect. So we discovered through this report, the lab report, these are all the silver particles that are found. As you can see, that they're all very well dispersed. They are not agglomerated. Agglomerated means they are all stuck together, clusters, so they're all apart in a suspended form, or known as colloid form, and they're all below 10 nanometers. Now, when I was with the professors and the research scientists way back in Canada and the States, we adopted all these protocols. These protocols are very important because it will then determine, whether there is actually ionic silver present in drinking water. And so this is what it says here. Now, the other thing that we needed to identify is the reaction of bacteria with the silver. Now, if you can see here, this is a dark field scanning trans-electron microscope. Unfortunately, we don't have it in this country. This trans-electron microscope, which is the one that showed earlier, the detection and identification of the silver particles, only 3 universities in Malaysia has got that machine. That machine is about 4.5 million ringgit, right? University Malaya, University Kebangsaan, and University University Science in Kubang Krian in Kelantan. Only 3 is $4.5 million. Now, this one here is called the dark field scanning TEM, and it shows the reaction of the silver particles rupturing the bacteria called E. coli. We decided to choose E. coli, as a test. So we wanted to know whether, how do we know? It's all hearsay. I'm just telling you, well, silver ruptures the cells or the DNA of the bacteria, but it's all hearsay. So we decided to do this test. Unfortunately, we cannot do this test here because the universities don't carry this machine, so we had to go to Singapore. And just for your information, the cost of this dark field TM is $25 million. Okay? So there you are. Right, now these are, I'm projecting some of these photographs here of a typical hospital that has got potentially the highest amount of bacteria. You all know that when you visit your relative or friends in hospitals, you either disinfect yourself, or you try and avoid places where there's a high rate of infected patients because you're likely to contract the infection as well. And this is very interesting. It is not only confined to. I will talk to you a little bit about what it does to replace and substitute antibiotics. Now, colloidal silver has got many uses. Right now, I can tell you now. We go to bedding. A lot of the bedding companies are now using colloidal silver to kill bacteria and also to drive away. It doesn't kill dust mites, right? It kills bacteria. It is used in poultry. We already have, I believe Trumer already has a customer. This kampong, the rare kampong chicken. Kampong chicken or even broiler chicken, ordinary chicken, they affect with hell a lot of antibiotics, right? And when you eat chicken, you must make sure that the chicken is properly cooked. It's just like eating pork. You have to ensure that it's properly cooked. And because there are so much of antibiotics stuffed in the chicken, poor chicken, then you're likely to have some adverse effects, maybe later on in life or not immediately. So we fed the chicken with colloidal silver water, basically, and we did this for 6 months, and the owner of the farm was so happy. He spends more money buying antibiotics, he pays less for the colloidal silver solution. So that's a tremendous amount of savings, for the chicken farm and the farmer as well. And it is used in upholsteries, in cars, carpets, washing machines. You probably will know LG already started using nano silver. Panasonic air conditioner already started using nano silver. It's all about nanotechnology, right? And hospitals and clinics, as you know, that we can also use this as a spray, and that brings me back to the products that you see outside there. One is for oral and the other one is for spray. Let me tell you what is acetology. Now, we all know that colloidal silver, of course, you didn't have the privilege to look at my clinical trials. Actually, I had one special PPT presentation all on clinical trials which we did in Canada and in Ghana and West Africa. We tested on many patients, real life patients who were infected with all kinds of bacterial and viral infections. And the conclusion of the treatment process that we did, 99% all recovered. So let's talk about the substitute for antibiotics. Now, if you are down with a common cold, or maybe you have a throat infection, you actually can drink the colloidal silver because it is in distilled water. Distilled water, as you know, is pure water, pure H2O, and you can drink it. You can drink it, like kingdom come. You don't have to worry about, side effects. And even the accumulation, so-called, questioned many times in forums with scientists in front of me. The silver particles, will they accumulate in your liver? Will they accumulate in your kidneys? They don't, because ionic silver, the moment it comes into contact with bacteria, it kills the bacteria and then it dissipates. It breaks down. And then it's flushed out through your sweat glands, through your urine. So it doesn't stay in your kidneys, neither does it stay in your liver. So there's no harm at all. It's 100% toxic free, no side effects. So when you are unwell, if you have a throat infection, if you have got, for example, a toothache, you can actually use the colloidal silver to gargle in your mouth, and in the most natural way, rather than using antiseptic, solution to gargle your mouth to reduce the pain or to kill the bacteria in your mouth if you have a tooth decay. And of course, the spray is also very good. You can spray on your face. Actually, as you know that we sweat a lot. Sitting down here, with the aircon, with people around you, you tend to have a little bit of dust settling on your face, maybe a little bit of bacteria on your face, maybe harmless. You can always spray in your face and just wipe it off, and it gives you a squeaky clean face, completely, it gives you a nice shiny face, minus everything that you have on your face. So that's what the spray does. It has got many functions. You can actually use it as an antiseptic agent. If you have a cut or a wound, you can just spray on it. Now, pimples, this I must share with you. This is sworn by a pharmacist in PJ. She has been selling all kinds of antiseptic creams, for the treatment of acne and pimples. And so I told her, you try these few bottles, give it to your patients for free. Those regular patients will come back and buy your antiseptic creams. And, couple of 2 months later, they all came back and they said, the pimples are all gone. So how do you actually use it? Very simple. You take the facial cotton, the facial cotton that the women use to clean their makeups. You just soak it with the silver solution and paste it on your face. Just leave it there until it dries up. Do it a couple of times. I guarantee you 101% your acne is gone. Try it out. We did one test with the mosque in Selangor. I did a swab test, bacteria swab test. We found that the carpets contain 5,000-6,000 CFU of bacteria more than fungus. And then the operating theatre, you find that operating theatre, if the temperature is too high, maybe about 20 degrees. 20 degrees can be a bit freezing. Bacteria tend to thrive, in this kind of environment. Now, nanotechnology is so advanced, you can even see them in containers. Baby diapers, right? And then also now they're using colloidal silver with ozone to treat waterways. This is another method that is used to treat clinics, for example, or your homes. If you want to have your home bacteria free, This is another method that we also apply. The Trumer group of companies was involved very successfully a couple of years ago to treat the hospital where I'm working now in Strabane. And we did the before and after tests. The before test was that the hospital was badly infected with bacteria. And after 3 months, continuous treatment, all the bacteria were gone because we do swab tests. Every month we do swab tests to make sure that, the bacteria is no longer there, it doesn't survive. So now the hospital has been renovated, it's been redeveloped, and we are planning to start back the treatment process in the next couple of months. Now, this is the another, using colloidal silver as an active ingredient. This is for commercial application. It is basically to offer you an alternative instead of using quaternary ammonium compounds. Quaternary ammonium compounds are very commonly found in Dettol and a lot of other disinfectant chemicals. And we did a test with Dettol. And of course, if you go into the website, www.dettol, you can actually extract all the material safety data sheet and the safety sheet that talks about the composition of the chemicals. And it's a class 3 cargo, means dangerous chemical. So if you're using Dettol to mop your floor, you obviously have to use gloves because they are abrasive, they are corrosive, and they are also very harmful. So I've done a comparison, and we discovered that we've got these significant advantages, efficacious, very effective, fast-acting, is non-toxic, non-stimulating, it doesn't create any allergy, whereas this does. Hydrophobic, it's got water repellency, repels water, then it's environmentally friendly, and it's a non-chemical process. These are some of the certificates. Let me show you this one here. This is a test that we did in Syrian. If you can see from here, we decided to use Escherichia coli or E. coli. We did a test of, this is 540,000, 540,000 count. Now, the normal infection rate of human beings is 100 CFU. So the moment I do a count in your blood, your hemoglobin or your blood itself, if I discover there's more than 100, that means you're infected. Immediately, my conclusion is that you're infected. So here you're talking about, 540,000, and then we also done 1 million, 2 million, and the kill time is 99.9. Actually, it's 99.99%. I mean, it's 100%, less than 10 initial count. So this is another test certificate from Germany. Conclusion. This is the findings by all the group of scientists in Canada. The 10 ppm nanocolloidal silver was found to be both bacteriostatic and bactericidal for all organisms tested. The data confirms that nanocolloidal silver has a broad spectrum antimicrobial activity and can be effectively used as an alternative to antibiotics. These are all the references, you can actually get them in the website. And there are more than 100 publications and references of nanocolloidal silver as a broad spectrum antimicrobial product. These are all the clinical data that I've got collected over the last more than 15 years. Alright, thank you very much, ladies and gentlemen.